The City of Glendale Common Council is now in session. All rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'll ask the Deputy Clerk to please call the roll.
Alder Vukovich.
Here.
Alder Doherty. Alder Gailhard.
Here.
Alder Bailey.
Here.
Alder Schmelzling.
Here.
Alder Shaw. We have a quorum. Mayor Kennedy.
Here.
Now we have a quorum.
We had a quorum before, but. All right. Next is public comment. Glendale residents, business owners, and property owners are invited to speak to the mayor and council on items that are not on tonight's agenda, but are within the city's ability to regulate or control. Is there anyone wishing to speak to a non-agenda item? I don't see anybody wishing to be recognized in the council chambers. If you're joining us on the Zoom and you wish to speak to a non-agenda item, you may now unmute and state your name and address. All right, seeing no one wishing to be recognized for public comment, we'll move on to the consent agenda. There are no, he's going to speak to a future item. All right, the consent agenda has 3 items, a change order, 2 change orders, sorry, and the minutes of our last meeting, which was held 3 weeks ago on September 22nd. Can I get a motion to adopt the consent agenda, please? Moved by Schmelzing. Is there a second?
Second.
Second by Doherty. Any discussion on the consent agenda? Okay, we will consider all 3 items adopted by unanimous consent without objection. Hearing no objection, we'll move on. We have 1 item of unfinished business, which is an amendment to the Architectural Design Services Agreement with FGM Architects. And I will turn this item over to, I believe, to the chief. This is on the police new PD construction.
Back in July, this council approved the design services from FGM Architects. The starting point was for that, which would proceed to this next step, which is the execution of complete design services. We received the initial cost estimate for the police station remodel, as well as cost estimates for all the components of the project. This amendment is to the agreement with FGM Architects for an additional $762,183 for FGM's remaining phases that include design development, construction documents, bidding assistance, and construction administration. These construction management and construction costs are not included in this amendment, and an agreement for construction management services would be brought to the council at a later date. Below is the current total cost estimate, and the capital improvement plan includes a total cost estimate of more than $10 million.
Are there any questions for the chief? Yep, Alderman Schmelzing, go ahead.
Just very quickly, I'm curious, what's the difference in the bidding between construction administration and construction management? That's different phases that I'm used to in IT world.
Yeah, so the construction administration, this came up in our conversation with them as well. That is the architecture firm that's still involved in the project, versus construction management is the actual, them managing the plumbers, the electricians, while the architects will be meeting with the construction management people to make sure that their plans are being dealt with as planned, and any adjustments that need to be made within that process, that's all encompassing with that cost as well. One of the things they brought up specifically was this being a full remodel, as it is, that's a crucial part of their contract to be part of that, because when they knock down a wall, the construction management is not going to be able to deal with something that the architects will have to deal with, a change. And if they said that's not part of it, we'd have to call the architects back to address that at that point.
It's kind of a combination. I understand. Thank you.
Yep.
Yeah, essentially they'll be doing the change orders, the quantities, and all that stuff, while the construction managers will manage the company and make sure that the timeline is being met.
Any other questions? All right, can we get a motion then to approve the amendment to the Architectural Design Services Agreement with FGM Architects?
So moved.
Moved by Gelhardt. Is there a second?
Second.
Seconded by Bailey. Any further discussion? All those, did you want to speak, Jim? Oh, I just saw you turn your microphone on. Okay. All those in favor of approving, please say aye.
Aye.
Any opposed? Motion carries. We'll now move on to our lengthy list of new business items. The first item is an appointment of a replacement on the Glendale Youth Council. One of the people who was appointed turns out was unable to serve, and so Alderman Doherty did have a replacement lined up for his district. Can you tell us a little about Evelyn?
Known Evelyn since she was a small child. She lives on my block. She's very outgoing, and I think will be a good fit in the sense of somebody who has opinions and very active in the community and involved in their volleyball team and involved in community, involved in church stuff and involved in a lot of different things. So I think she'll bring a lot of breadth to it for a 10th grader. She's a very mature person, and I think it'll be good for her, good for us.
Thank you. I appreciate you finding that replacement so quickly. All right, can we have a motion then to approve Evelyn Stofflet representing the second district on the Glendale Youth Council?
So moved.
Moved by Alderman Doherty. Is there a second? Second by Alderwoman Shaw. Any further discussion? Okay, all those in favor of approving, say aye.
Aye.
Opposed, no. Motion carries. We're now moving into presentation and discussion. Actually, we've got two of them here, and I think these are being led by our Assistant to the City Administrator, Ben Poloni. First one is on the electronic communication system.
Test. Evening, everyone. I'll try to be swift so we could get to more important matters like the baseball game. So Constant Contact is a new agenda software, or sorry, not agenda software, a new communication software that we launched at the end of September using emails and text messaging as a way to connect with our residents. So next slide. So Constant Contact, what we get from it versus what we used prior, which was Civic Plus's integrated method of emailing people that sign up. One of the most important things is data collection. Constant Contact allows us to collect numerous data points when we send out emails, such as where people are clicking, how much they're clicking, and all sorts of information like that, which allows us to improve upon prior emails. Enhanced design capability. It kind of ties in with the last part there, richer integrations. We're able to integrate it with Canva, and they have numerous other built-in tools for designing, plus our subscription allows for free graphic design from internal staff that they have over there. Clickability, that's, compared to our prior newsletter where we had to rely on QR codes and the likes, we now are able to integrate links and buttons for people to be able to just easily get to things that we want them to. And then, of course, text messaging, we have that included in our plan that we're primarily saving for emergency-related things after our experience with the flood. So this will allow us to quickly get out communications to people in the event of emergency. Next slide.
Would that be text messaging from like a laptop or a desktop interface? We go in and basically put in a message
Yeah.
and then blast it out and it ends up on everybody's phones?
Yeah, we would use it from the internal, yeah.
Okay.
So this is just a brief look of comparing, what it looked like before with the Civic Plus to what it can look like now. There's obviously a lot more design potential, and plus it's better for the user interface. As you see on the right, it's optimized for mobile viewing. Next slide. So just some key things, we've sent over 2,000 emails so far. Most of them have been delivered. Obviously, there's some bounces. Our open rate is 73%, which is plus 30% more than the industry average for local governments, as well as our click rate, 14%. Obviously, a lot of people open, but they don't always click, but that is still 12% more than the average for local governments.
Just for clarification, it's 420X so far within the cities, like
Correct, yeah.
12,000.
Yeah, and that's about 8% more than what we had imported over from Civic Plus, so we got more sign-ups since then. So this just shows the top line there is our overall open rate versus the industry average, which is the line below it, and then also the solid blue line is our click rate versus the industry average. So you see there that we're obviously trending above. As for that, 422 contacts, we see that we clearly have it's small, but it's very engaged group of people that we have so far, and we do hope to grow that. Some examples of data that we have here, you could see on the left, the different open rates for the different campaigns that we've sent out so far, from the Silver Spring project to our different newsletters, and the total click rates on those different campaigns. And, in the future, what we're hoping to do, obviously, we want to get over the 500 plus mark, which this makes it very easy to do, with easy for people to sign up and everything. With the integration opportunities, we hope to also start doing more surveys and collecting information from residents on topics of interest to the city. And then, of course, community engagement. This allows us a lot more opportunity to learn about what our residents are engaging with, and then thus push out more relevant information, and also just refine how we're engaging with residents digitally. And yeah, that is it for Constant Contact.
I think it's great. I mean, we've used it in other organizations. This will be a lot easier for people to join on. I assume we'll blow 500 away as far as number of people who sign on.
Yeah, I hear a lot from residents about wanting it more clickable and such, to have that toolkit built in. Yeah, that helps a lot.
Alderwoman Shaw?
Couple of questions. In the presentation, you indicated to Mayor Kennedy that the text messaging will only be used internally. Defined just for people here, or?
Oh, no, sorry. I meant only for emergency purposes.
Okay, because you said that as well as only used internally. I just want to make a clarification so I understand correctly.
No, it'd be used for residents externally, but only for emergency purposes.
It can only be sent out by staff and
Oh, yeah, it can only be sent out by staff internally.
Okay, and how does this compare to MailChimp?
MailChimp, I haven't honestly looked much into that. Because Constant Contact is one of the more predominant things used by local governments in the area, such as Whitefish Bay and Shorewood and whatnot. And I haven't heard anything about them having like text messaging capability.
They do,
Okay.
and they have the integration, so I was wondering if you compared costs.
We did not compare costs of MailChimp, no, but it's certainly something that we can look into.
I would appreciate that,
Mhm.
just because I don't want to go at something just because somebody else uses it. I just want to make sure it's also cost effective for the city.
I would point out that we did receive significant discounts from Constant Contact for our governmental status, over 30% off.
So the annual cost to this is about $300 a year.
Constant Contact.
I just wanted to make sure that we were comparing,
Because I did a comparison recently, MailChimp doesn't do as much as this software does, in the sense of being able to navigate who getting people off, making sure that we're not sending to bogus emails, stuff like that. They have a bunch of safeguards. So it saves a lot of time and effort, and to clean up a MailChimp list is horrible. I've done it twice now, and MailChimp's for a different place. I wouldn't do it for here.
you could just check into the price on it.
Yeah, we could
Just-
definitely look into the price. We're only committed for a year so far, but it's definitely something we could look into and always reevaluate.
Any other questions? All right, we'll move on then to the next presentation, which is on our agenda software.
So this one, just real quick, I've had some questions from some alders about, sort of getting a handle on how to best use the software program. And I'll just have Ben run through this real quick. If you have any questions or want to go through with them, please feel free to schedule a meeting or call him or email him. And he can help you out with any specific questions on it.
So next slide. All right, so yeah, there's just two predominant ways that you can view the agendas. There's the board portal and the public portal, which generally we send out with every agenda. Top left is the board portal. From there, you can, in the top, you see like the two blue options. You can download the whole agenda packet or whatever, and you could also then click on the individual items. And then the public portal, which is what we use to present here, you can search through the calendar or type in dates for specific meetings and also sort that way. and click on the individual meetings themselves. Either way, they take you to the next slide, where in the top with the board portal, you can download the individual attachments for the agenda items, so the memo, anything else that comes with it. You could also take notes if you want to, although beware it is subject to open records request. And then the bottom right, the public portal, you're able to just click on the individual attachments and they just come up on your computer. So, often enough, the public portal is just generally a preferred way to view things if you don't like to download anything and have it eat up space on your computer. So yeah, that's just a brief overview of the two different ways that you can view the agenda.
Any questions?
Just want to thank you for getting all this set up. I know we've made lots of strides in technology, and I keep using just the downloaded version, but I could really utilize like some of these other tools with online notes, even though it would be open. But also the searching ability, I think, is key to call out. Like I used to have to dig through old downloaded packets. I still do that. I don't know why. I got a searching tool now. So it's great to have that for anything that's. How far back are the records loaded?
So I was just gonna bring up that point is when you go into the public portal, there's a search there and you can type in like pay app or anything specific like start construction and it will search for it. I believe all the board packets that we ever have now been imported into that. So I've used it quite often to try to find something specific because to me that has been the most efficient way to do is go to the public portal, search for Steve Schmelzling, and you'll find a lot of comments in the pack. No, you can find anything and everything by doing it that way.
Thank you. I'll have to go back and, check my notes.
All right, any other questions? Okay, thank you, appreciate the presentation. Okay, the next item then on our agenda is approval of the 2026 North Shore Library budget.
Thank you very much, Mayor. I've hired Robert to come make this presentation. No, I'm joking. So
Enough.
the agreement for the North Shore Library limits the amount of increase as indicated in there. This increase for 2026 permitted increase without approval of any council or board would be 2.34%. The request is to go to 3.4%, and the primary reason for the increase is the library prior years neglected to have property and liability insurance, and that was never included in the budget or as a cost. That's a $14,000 add to the budget, and in addition to that cost, there's an additional $8,000 necessary for dual payments of CAM charges at both facilities. Nathan has been working to negotiate some of that away with the sale of the property and with the hopefully new planned unit development that is coming with that site. But to err on the side of caution, we included that additional $8,000 in there. So that's an additional, 14 and 8, that's $20,000 in costs in the library budget. A 1% increase is worth approximately $9,000 in the library budget. Without these two items in there, the operating budget increase would be about 1.1%.
Questions?
I got a
Hard.
I thought that Lamakia was waiving CAM charges for the existing library. Wasn't that part of the discussion?
Yeah, the back CAM charges. So there's the monthly CAM charges that are paid per the agreement, and then there's also the capital CAM charges, which are charges that aren't included in the monthly fee that replace landscaping, replace lights, replace the parking lot, and things like that, which totaled about $750,000 that are being waived. That's correct. You're going through that.
Yes, that's correct. And I just had a discussion with the attorneys for the owner and developer last week, and I reiterated that point with them and indicated that was part and parcel of the dollar amount that we talked about as the transaction at $750,000, and they're in the process of putting together some things for the planned use development. But yeah, I definitely raised that issue and made that point, and they said that they agreed, they understood that, and so that'll be part of that'll be part of, that'll be reflected in the closing documents in the final purchase agreement.
Okay, so it's going up 3.4%? That's what we're gonna vote on, if correct. But and I just want to point out, and I want to ask this because that's why I called you. Overall, this budget is going up significantly because they're using a lot of fund balance money or their fund money in it, or fund balance money in it. Budget is actually going. What, when they come back next year, what is the percentage that they're gonna ask for the increase on? Because that's my concern. It should be around anywhere less than, was it 2.34%, correct?
Yeah, it's the allowable increase is the previous year's member agency levy plus 1%. So this year it was 1.34% plus the 1%, which means it's 2.34% this year is the allowable increase. The actual budget and spending is a little it's difficult to explain, and I know the operating budget is going up 9%. The municipal contribution being asked here is 3.4%. The 9% increase, a lot of that has to do with different waves of how they use the Friends money to buy different books, and this year is a higher year for that as well too. Andy Peterson and I, who's the fiscal agent for Bayside, who does a lot of the financials for this, have discussed the opportunity to remove some of those one-time costs from the operating budget, so it doesn't show it as a operating cost, and allow the Friends to be handled differently, so it's not shown as such a large increase, because really the contribution from the municipalities covers virtually all of the costs other than some fees and fines, and then the Friends are included in that as well.
And that's the only reason, because if next year they will ask for an increase of that total operating budget, which is a lot of that is one-time spending. But if they're allowed to look at last year's budget, and if that is still in there, then they will be asking for an increase with that one-time monies.
This approval is not contingent upon that whatsoever. The approval and what's required tonight is because of the municipal contribution amount. So the contribution for the municipalities is what they're asking for the one-time increase for, not the operating budget. So because the municipal operating expenses is above the allowable limit of 2.34%, that's what we're increasing it by. And yes, that would stand there because that includes the insurance of $14,000 that was never in the previous budget before.
Yeah, that property was never insured.
We got really lucky.
Any additional questions or comments? Yeah, sorry, Alderman Vukovic,
Just
are you
follow
done?
on Tamika. What she's asking, right, is saying that they won't get an up next year because they got the 9, they're putting the other amount in. I think that's what.
You're talking about compounding, right? It goes up 9% and then next
they-
year it goes up 3% with the included 9%. Is that what you're asking?
Right.
They don't get.
So it won't be 11% actually, or 11%. It will be taking those funds that are one-time funds out, and they will be asking for an increase of opposite, or taking out those one-time funds, not everything that's in the one-time fund. But you said it's not part of the operating budget.
Yeah, the budget for the library is approved automatically as long as the library board approves it within the stipulations in the agreement. So they come to you with a 2.33% contribution increase from the municipalities, it would be adopted, and then it would be presented to the Common Council as part of the budget when we view it. In this case, since it's above and beyond the allowable limit only for the contribution. The budget is not mentioned in the agreement. It specifically references the municipal contribution. So the 9% increase is not something that they're locked in at a high amount. They're going to be locked in at a 3.4% increase for the municipal contributions from us, and that's it. So it's 3.4%.
Okay, that's what I was trying to get at, and
Okay.
not necessarily the full 9%. Okay.
Correct.
Any other questions? Yes, Alderman Doherty.
We've always had some challenges understanding some of the financials in this group. I would like it in the future that even though it's not part of the operating and it's, again, friends put money in or whatever, I'd like that all reported, not mixed together, but maybe separate columns. But I mean, show what's actually going on there all the time.
Yeah, I have the specific budget, and I probably should have included in this for discussion purposes, and I can forward it to all of you guys.
But you know what I'm saying? Even
Yep.
the part that we just approved, I'd still like to know what they're spending in total, even though they went out and raised money and did other
Yep.
things. That's great, but we ought to see all that.
Yep, we can do that. That's no problem.
Alderman Schmelzing, go ahead.
But just for clarity, the CAM charges, I understand the budget pieces and, we're lucky nothing burnt down in the place. So yay. Prior. So, so the CAM charges, this is operational CAM versus a capital CAM?
Yeah, there's two different CAM charges that are included in the agreement. One is an operational, that's a monthly one that the library pays to the owner of the building that just, you replace the sprinkler heads or the fire extinguishers or various things like that, cleaning and all that sort of stuff for the general areas, window washing, landscaping on a normal basis. But then there's also the capital CAM charges, which the owner has the ability to pass on based on the percentage of ownership in the building, repair and replace the parking lot, the roof, the general air conditioner, fix up the bathrooms. Those can all be passed on. And the estimate right now to do that today that we talked about through the capital campaign of the library was $750,000, which was waived by Mr. Lamacchia as part of us moving. So that part is being placed in the agreement for the sale of the property right now.
Got it, understood. So only parting comments is this is kind of the cost of moving, is having the duplication of the fees at the same time. So part of me thinks that should have been kind of bundled in the cost of the migration and the move and all the shelves and everything else. But I get it. It kind of came up as a secondary thing, and hopefully it is something that they can work through because from my perspective, we're trying to get out of there as soon as we can now.
We had a lot of discussion about including that as part of the capital stuff, but we elected not to include that in there because it wasn't part of the line item budget that we guys approved for it. So we were sort of stuck on where to put it, and we decided here.
Essentially, it's a carryover for a couple. If you're renting a place and you go and purchase a house and then you decide to spend 2 months doing renovations, you're paying a mortgage and paying rent both places. And that's essentially what's happening here. There will be some overlap of a couple of months where we have CAM charges at the new building and still existing CAM charges at the old building.
And electricity and stuff like that, but
Right,
we didn't
right.
even factor that
Yeah.
in here.
All right. Can we get a motion then to approve the 2026 North Shore Library budget as presented? Anyway,
Moved.
thank you. Move Alderwoman Shaw. Is there a second? Second by Alderwoman Vukovic. All right. Any further discussion? All those in favor of approving, aye.
Aye.
Opposed, no. Motion carries. All right. Next item is an authorization to execute an agreement for professional services for the Public Works Garage HVAC replacement with Clark Dietz, and I'll turn it back over to Mr. Warwick.
Thank you. So the HVA system rehabilitation project is included in the 2025 budget and has been included in the capital improvement plan. Essentially, the HVAC system is not compliant with general OSHA regulations for ventilation. Processes that have to be done manually rather than automatic. It requires an upgrade. We've discussed this project all year, and we feel after attempting to go out to bid without a real design and just using specifications, that it was recommended that we spend $25,000 to try to achieve the best and lowest cost by designing the project rather than bidding it with a spec sheet from a contractor that provided it to us. That way, they can evaluate the area and determine exactly what needs to be done versus the spec sheet.
I think there's a lot more work here than just swapping out an old unit for a new unit.
That is correct.
Okay. Alderman Doherty, go ahead.
How'd we get here? It's not that old. The specs change. I don't understand. I'm a little confused on how we have a non-compliant building.
Built in
Now.
85.
I'm not exactly sure how we got there, but OSHA regulations require that the venting system vent automatically. In order to vent the system with vehicles in there, we have to manually open and close them, which is not OSHA compliant.
That's from 85? Is that?
Building was built in 85.
Okay.
All right, any additional questions? All right, can we get a motion then to approve the professional services agreement with Clark Dietz?
So moved.
Moved by Bailey,
I'll second that one.
seconded by Schmelzling. Any further discussion? All in favor of approving, say aye.
Aye.
Opposed, no. Motion carries. We're now up to item F, which is consider authorizing the city attorney to file a mandamus action regarding the housing of two sexually violent offenders on Silver Spring Drive. Turn it over to the city attorney. I do have a member of the public who's joining us on the Zoom who asked to speak to this item, but we'll go ahead and let you present first. So, Mr. Bear.
Sure. So this is sort of an extension of one of the options we discussed in closed session a few weeks back. To summarize, there are two individuals that were placed under Chapter 980 of the Wisconsin statutes to live on the Silver Spring Drive, just across from Glendale. And the state statutes currently state that these individuals that have been designated as sexually violent under Chapter 980 are not to live within 1,500 feet of certain areas, including park space, areas like the Oak Leaf Trail area, the soccer park, all this other kind of, all these other areas. We previously had the city engineer work up a map demonstrating all of the restricted areas within the 1,500 feet. We've asked the county, and there's a county-appointed committee that places these people. We asked them to take action, and they essentially ignored our request. So we're at the point where we're looking to move to file a mandamus action to get the county to follow the law when they're placing these individuals, and it has really bigger applications or implications than just this one case. It certainly will, in the future, we hope, compel them to follow the 1,500-foot restriction. That we've been told that, well, it says 1,500 feet, but we don't really follow that. If it's not, we don't really apply it as the crow fly. It has to be either as driving or walking distance, which still doesn't explain how they rationalize placing it within 1,500 feet of the parkland area, which clearly is within 1,500 feet. They basically just told us they don't take into consideration the Milwaukee County Parkway because it would be too hard to place people otherwise. So this is raising a larger issue, I think, for future as well, and to try to get these committees to follow the law. So this would be authorizing the legal action to do that.
And it's clear there is an issue of executing the state law because it basically rules out so many different places, particularly in a very heavily developed county like Milwaukee County. But that's a state law problem. They have to follow the law. If they want to change the law, then they need to go to the legislature. But in the meantime, they need to follow the law. That's it. All right. So Mr. Swanson is asked to speak to this. So I'll let you unmute and please state your name and address.
Brian Swanson, 1820 West Wayside Drive, Glendale, Wisconsin. And I'm going to ask this body to please vote yes on this agenda item to ensure our community is kept safe and that the county is held accountable to the state laws of which our state legislation has gone and passed. Thank you for your time this evening.
Thank you, Mr. Swanson. All right. So any questions from members of the council? All right, so before us is a recommendation that we authorize the city attorney to file a mandamus action. This is a case we've been following for a while. We already engaged in one particular legal avenue that was unsuccessful. So can we get a motion to authorize the city attorney to file this action?
So moved.
Moved by Doherty,
I'll second.
seconded by Gelhard. Any further discussion?
I just
Yeah.
want to ask the attorney, I think this is just a question of fact, excuse me, a question of law. It won't be a fact-finding hearing as I see it.
Well, I would take the position that it's a pure question of law. the county may take the position that there's some ambiguity in how some of the, how the child safety zone area is defined and some of the items within the 1,500 feet and whether or not you should count the Milwaukee County Parkway and the Oak Leaf Trail and those types of things. We think that those are pure questions of law and there's really no fact finding involved in that. So that is absolutely 100% the position we are going to take.
Okay.
Further discussion? All those in favor of the motion authorizing the city attorney to file the suit, please say aye.
Aye.
Opposed, no. Motion carries. We'll now move on. The next several items have to do with the North Shore Fire Department. So it's the fees for service, allowing an option for member municipalities to claim exemption from the levy limits, and then approving a single or multi-year capital budget. So I'm just going to turn it over to the chief and let you present on all of these, and then we can move the three resolutions.
So do you want to do them all at once?
Yeah, go right
Okay.
ahead. So really, I mean, when we handled them in the fire department board meeting, you just kind of spoke on all of it together because it's really,
Yeah.
it's maybe three separate resolutions, but it's all one budget, right?
Yep. Okay. So the first one is the fees for service. The North Shore Fire Service Agreement requires that, excuse me, the municipalities, at least 5 of them, adopt the fee for service resolution that is recommended by the board of directors. So the board at their last meeting recommended a fee for service schedule for 2026. That is included there are 3 parts to that fee schedule. One is the EMS fees, primarily ambulance transport. That makes up about 17% of our revenue total for the year. Then there's a inspection and plan review fee, and then there's what's sort of the other category, which is like open records requests and things like that. The biggest change to the schedule this for 2026 is the ambulance transport fees. We did a little more in-depth dive to see whether or not we were recovering our costs for doing ambulance transports. There's a federally accepted formula that is used for Medicare and Medicaid that looks at the cost of providing the service. So you come to a cost for providing transport, and we looked at that compared to what we were charging on the fee side. The calculation we came to using that federally accepted method is just over $1,900 per ambulance transport. You'll see in the memo that is included with the packet that our current fee schedule is under that, depending on, and it varies anywhere from about $900 to, I just got to get to the right page here. We go to about $1,400 for service, so we were under the cost. Now, the current methodology also then charges itemized billing for disposables and other supplies that are used in addition. So the bill that someone would get would say the base fee is, and I'm looking at page 2, for let's say a BLS resident transport is $924.68. Then we add on supplies that are used. So the average bill for 2024 and 25 was just over $1,000, $1,027.16. You see that for the various categories for ambulance transport. So there's then we looked at also what other communities in the area are charging for services. That chart is on the bottom of page 2. Waukesha, Western Lakes, Wauwatosa, Greenfield, Franklin, and South Shore, you'll see their rates there. All of them are charging more than we are. And then we looked at what was acceptable as far as Medicare rates, and there's some legislation that's pending at the state level that would potentially, if approved, require private insurers to pay for ambulance transport at 400% of the Medicare rate. So that would get to the numbers that are on page 3. So we took all that information into consideration, came up with a new fee schedule that we proposed to the board with the primary changes on the bottom of page 3, and that is for the different levels of ambulance transport. So BLS service with transport resident, $1,800 on the bottom end of that chart, and on the top end, ALS 2, which is the most invasive level of service we could provide. That's you're getting multiple medications, you may be getting blood or something like that. That's for a non-resident at $2,500. And you'll note that the resident rate is discounted slightly in that chart. So the total change there for the transport service is larger than we normally would move the number. The rest of the services for people who, let's say, don't go to the hospital, it changes 1.7%. That's the average of the CPI of Medicare, medical care and commodities for last year. That's the biggest change. Are there any questions? Because that's got a lot of moving parts to it.
Question, making sure we're clear on the resident rate versus non-resident rate. Is that for the patient or is that for where, like, for example, if we respond to something in Milwaukee, is that the non-resident, or would it be if someone from Mequon has a health event at Bayshore and you respond, the patient is not from one of the 7 communities and so they're non-resident? How can you just clarify that for
The
us?
patient address that they give us when we pick them up. So
if you responded to an event in Milwaukee, but it was, say, a Glendale person, that would still be a patient.
Get a resident rate.
Resident rate. Okay.
Correct.
Thank you.
Yeah. Any other questions on the ambulance transport?
I got a question. So if I understand correctly, in reading this report, when you did a study, it costs about $1,000 for transport, ambulance transport, if that's
$1,900.
Well, so this figure that shows up on page 2 of the report, in consultation with the firm that assists the department with billing for EMS services, staff evaluated the average charges for each level of transport and the payer mix for the department. And then the first line, BLS service with transport, $924, and with supplies, $1,027. Is that not what your cost is?
No, that's the charge under the current fee schedule prior to change. That's the charge of the $924.68 plus whatever disposable supplies we billed out for. So that the average bill for that level of service for 2024 and 2025 year to date was $1,027.16.
Okay, and where does that figure come from?
That is an average of all the invoices that were sent at the BLS service level to residents. For the
I assume that was based on something that you like, oh, this is how much it cost us.
No, that number is on the top of page 3. And there's a bullet point, and then there's a sub bullet point that says an analysis recently performed by the department. Then goes on to say the average cost to perform the transport was $1,978.07 in 2023 and $1,960.41 in 2024. So from a cost to provide the service, we've been underbilling is, I guess, the summary of what I'm saying.
Well, then why wouldn't you have been billing at this higher rate all along then, if that was the case?
I think there's been some that cost to provide that service. That's analysis is a fairly new factor used in the industry with some of the changes in billing at the federal level that has been done. And the prior, for many years, it was looked at as what is the average, what other communities are doing, and everyone has always sort of stuck together. But I think in the last couple of years, communities have started doing this analysis based on this formula and come up with much different numbers.
The trouble, quite frankly, that I have is that you're asking to double the fees on the ambulance. $924, now $1,800, and basically all the way down the line there. First of all, I don't think that any resident of any of the 7 communities should ever have to pay anything because they're taxpayers, and that should be included. Now, my understanding in the past is we bill the insurance, and if the insurance pays, great. If not, then we don't go after the resident. Is that still the policy?
So there's 2 different levels. If Medicare and Medicaid, we can bill that. If we bill at the rate and Medicare and Medicaid pays anywhere between $300 and $500 for service generally, we cannot go after the balance there. The second, for what we call private pay or people with private insurance, which is only 14% of our patients, there may get a balance bill. The legislation I was talking about earlier would prevent that from happening. That has yet to actually get assigned a bill number yet, but that legislation is out there. So there wouldn't be a balance bill. But right now, there would be a balanced bill. So if insurance paid $1,500, let's say on the $1,900 bill, there'd be a balance bill sent to the user of $400.
And if it was, for instance, if the insurance pays $600, you'd send them a bill for $1,200, for instance, in a BLS service with transport.
Potentially, yes.
Yeah, okay.
Okay. The next resolution or item on the agenda is the levy cap exception. That is a required resolution that has to be passed by all municipalities that participate in the joint fire department. If any of the municipalities want to use the levy cap exception authorized by state statute. So that allows a levy cap exception for joint fire departments up to CPI plus 2%. The change for North Shore Fire Department this year is CPI plus 0.5, so 3%. So the city of Glendale uses that. I believe at least 5 of the municipalities use that on their levy limit worksheet annually. This has been authorized by all 7 municipalities annually since 2016, but it's required by the statute to do it annually. The last one is the single or multi-year capital budget. This is a budget used to purchase large vehicles, fire engines, ladder trucks, and ambulances. It's separate from our operating budget by the North Shore Fire Agreement. This requires all municipalities consider this as a separate agenda or action item for these items. The resolution covers a period of 5 years. We used to do this just for a year, and we would do it every couple years when we needed to buy something, but lead time on vehicles has gone from 1 year to 4 years. And I can't sign a contract unless I get commitment to pay from the municipalities. So we have a lead time problem. Additionally, there's been anywhere from 40 to 100% cost increase on these vehicles. So we see a significant increase in 2026, which was I'm going to call it a planned increase from 2023. 2023, the fire department board went through a planning and looked at options for funding these larger vehicles due to the large cost increases. A ladder truck that was $960,000 just about 5 years ago we just signed a contract for $1.9 million for the same vehicle, basically just updated spec. So the cost in 2026, the board looked at a couple options. One was a leasing option for these vehicles. The other was a purchase option, pay as you go with cash. The board recommended to move forward with the pay as you go with cash and look at an increase from the municipality contribution in 2026 versus do it right away so communities could plan for that. I believe that's in your capital plan as is included here. And so that requires a resolution adoption by the council and requires all other 6 municipalities to approve that too.
Essentially how we have a capital improvement plan budget that's 5 years for the city. The fire department is essentially doing the same thing now so that we can plan. And this lead time issue, like I remember first couple of years I was mayor, okay, we need to replace a fire engine next year. We'd authorize it. The chief would go out and in 14 months or 15 months, we'd have a new fire engine. And now it's 3 or 4 years. So
51 months is the last estimate for the one we just signed on. 51. 2029 for what I will sign probably later this week to get delivery on. So it's really made it tough also to project when these vehicles are going to be needed to be replaced. So we're almost living on just a sort of a data projection, not an actual let's look at it, because if we go look at it and it's starting to fail, we have to wait 4 years to get something before we can just get it. Whereas in the past, you could probably limp something along for a year.
any other questions? Alderman Schmelzing.
I'm just looking ahead on the funding included with this resolution and lists out the various vehicles. I don't have a perspective of like your full inventory. Like, is this a large wave of what we're looking to replace at this point versus is this like something that will be, looking out another 5 years, there'll be another vehicle every year? Just trying to get an idea like what the the cost would be? Because I'm,
Yep, so the next 4 to 5 years are sort of a larger wave just based on life cycle of vehicles. We're trying to separate out our ambulances a little bit so it's a little more consistent. Right now, we have 7 of them and they last 10 years as their turn. So we're trying to get it to be about every other year. Maybe you have to do a couple. So this is the year period where you'd have to do a couple of years in a row. The fire engines of the 3 that are in there, we have 5 in the replacement cycle, I believe. So we sort of get this 5-year period here. And we've bought 2 maybe over the last 6 years. So this will be a sort of a turn. And then the ladder truck, we have 2 ladder trucks. So those are a 15-year life cycle. And they were purchased, I believe we have a 2012 and a 2017. So we're sort of running back to back. We're trying to spread it out, but you're sort of stuck.
Keep in mind, we consolidated in 95. And so we made a bunch of purchases in those first few years of a joint fire department. 10 years later, there was another wave of big purchases. 10 years after that. So we just passed 30 years. So we're now at that point where there will be another wave of purchases again, because the life cycle of most of these is about 10 years.
Right. And with the ambulances, one of the big problems we run into is the number of miles we put on them, because there's not a close hospital. Our average transport is 14 miles, and that's 28 miles because you have to go there and back. Whereas most communities have a hospital in their backyard. You look at Wauwatosa, West Allis, they have Froedtert Hospital, they have West Allis, Aurora. Our closest ambulance transport is either going down up to Mequon, Grafton, Sinai, or St. Mary's on the east side.
The Aurora on Good Hope is not a hospital?
No, we pick up a lot of people there and we take them other places, but we can't.
They have an urgent care, but
they have an urgent care.
Okay.
Call us to take about 2 patients a day out of there. Yeah.
Any other questions? Okay, so we have 3 resolutions. We can have a motion to adopt all 3 resolutions in block, or we can have a motion for each one of the 3 separately. So somebody want to make a motion to adopt all 3 in block?
I think we should.
Moved by Shaw, is there a second?
Second.
Second by Bailey. Did you have a concern about that?
I think we should take them up individually because they're different things. Completely different things.
Would you mind withdrawing your motion? Okay, would you mind withdrawing your second? Okay, so we'll go ahead and take them separately then. First one would be a motion to adopt the department fees.
Moved.
Moved by
Second.
Vukovic, seconded by Shaw. Any discussion on the fees? Alderman Gelhard?
As I suggested in my comments before, I have a problem with these ambulance fees doubling. I don't think that residents who pay taxes here should have to be subject to these types of fees if they call for North Shore Fire Department Fire and Rescue. It would be one thing if the policy was, well, we'll bill the insurance. If we get insurance, fine. Otherwise, we're not going to go after the resident. That isn't the policy, and they will go after the resident for any excess that the insurance doesn't pay. I don't think that's right, and that's why I'm against this fee increase.
Alderman Schmelzen, go ahead.
So just the study that was done, that covered the whole cost, and if it was at like $1,900, correct?
Yeah, correct.
Okay, so, and then right now, what is the Medicare reimbursement rate? Because that's the majority of our.
Anywhere from, I think they're up to about $304 on the low end and $583 on the high end.
Okay, so ultimately what's happening until we get this, hopefully legislation passed that would force that to be private insurance. But even then, Medicare wouldn't be at that higher amount reimbursing.
No, right, they would stay there. Some Medicare plans are subject to some new legislation where the federal government basically matches their own money. It's really weird, but that is correct. That really won't change. And that's unfortunately the healthcare system we're part of, is that the private payers are paying a large portion of the bill.
Ultimately, if we think about it, we have private payers paying a portion of the bill, but at the same time, we have insurance companies sometimes paying, and then the fire rescue is just trying to break even with these fee increases.
Right, yeah.
Okay.
Maybe a point to Alderman Gelhardt's comment, and I respect your position, but I probably should have said earlier, several communities have tried the method where they don't balance bill on residents, and that has been challenging for them. I think one of them is the city of Wauwatosa, who I believe is considering changing their policy on that. They tried that for a couple years because the policies that people have are so different with deductibles and copays. It was tough to get a standard payment. So if insurance only paid $600 on because of your deductible or copay, and on one resident and another resident it paid the full boat because you had a low deductible and you paid a lot of money for your plan. There was a lot of variance as to what they were bringing in on those.
Isn't that what the policy used to be with the North Shore, wasn't it?
Not as long as I've been the chief. I don't know if it was before that. It could have been.
I sort of equated this to the situation we had with our water bills, where we hadn't had an increase for a long time, and then we did a study to see what our water bill rate should be. We then went to the PSC, and they said yes, and they agreed to it. And everybody complained that our water bills went up so significantly, but there hadn't really been an increase. We had been essentially undercharging for years. It's a similar situation with the fire department. The fire department has been undercharging for years. Then when you set a rate, Medicare is only going to pay a portion of that anyway. They're never going to pay the full amount. And so it's just impossible to ever break even on the most expensive part of what we do, which is take people to and from the hospital. Yeah. All right. Any further discussion? So it's been moved and seconded, and I know there's not going to be a unanimous vote on this one, so I'm going to ask for a roll call and ask the deputy clerk to start the roll. You're starting with number. Call the roll starting with Alderwoman Shaw. And then go to 1, 2, 3, 4, 5. Yeah.
Alder Shaw,
Yes.
Alder Vukovich, Alder Doherty,
Yes.
Alder Gailhard,
No.
Alder Bailey,
Yes.
Alder Schmelzling.
Yes.
By a vote of 5 to 1, the motion does carry. And the resolution approving the 2026 North Shore Fire Department fees has been approved by the city of Glendale. All right, the next one then is a resolution authorizing an exception to the levy limits for pursuant to Wisconsin Act 484. Can I get a motion to approve that resolution?
So moved.
Moved by Doherty, seconded by Vukovich. Any further discussion on this one? All right, all those in favor of approving the resolution, please say aye.
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 Opposed, no. Motion carries unanimously. And the third item is a resolution approving the capital budget as presented by the chief tonight, a 5-year capital improvement budget for the fire department. Can I get a motion to adopt the resolution, please? Moved by Vukovich, seconded by Shaw. Any further discussion on the capital improvement plan for the?
Real quick.
Yep, Alderman Schmelzing.
Keep in mind, we might need a new brine truck. So
Talked to Charlie about that the other day. He's got a different plan though.
that's
He,
it.
he likes the brine truck, but
Just a little comic relief there
Yeah.
when we're talking about so much money. All right.
Discussion? All those in favor of approving the capital budget presented by the fire department, please say aye.
Aye.
Opposed, no? Thank you, Chief. All right, next item is adoption of employee handbook changes, and I'll turn it back over to Mr. Warwick.
Thank you, Mayor Kennedy. So there's 2 versions of the handbook that are included. One's a red line version and the other is the clean version for possible adoption tonight. I can run through some of these changes real quick, just a few changes in cleaning up some of the items on management structure. The big change here is establish is a policy on the management and use of credit cards for city employees. As part of that, we wanted to create a policy on small purchases that was not covered under the purchasing policy before. Further clarified that personal vehicles, if you use them, don't use a city credit card. It must be reimbursed at the IRS approved rate for mileage. It includes Juneteenth as a city holiday to be consistent with the collective bargaining agreement. Increases the per diem rate for out of town travel from 50 to 75 to be consistent with the daily cost of meals for travel purposes. We made an amendment on the possession and consumption of alcohol to be consistent with the city practice, most notably just social events that do occur on city property. And then we included the organizational chart as a exhibit in the handbook.
Okay, thank you. So I just had one question. On the per diem cost, because there is inflation every year. I mean, I would ask everybody to approve the employee handbook tonight, but I'd actually like to ask you to bring back one more change in the future that essentially establishes the cost and then with an automatic CPI change every year. That way we don't have to keep approving it every few years when we realize that it's not the right amount, right? It's not keeping up with inflation, so.
Yeah, rounded to like the nearest $10 or something, so it's simple.
Yeah, or the nearest $5. And so like if inflation goes up 3% this year, then we'd go from 75, maybe it doesn't go up next year, but 2 years from now it goes up to 80 or something like that.
What I would recommend if we do it, just increase it by $5 a year or every other year.
I don't know if you always have inflation though. I mean,
You-
I like the way to do something where it kind of self-heals, right? IRS rate, we're using, say, the IRS rate for mileage, just so you don't have to re-say it, that's all.
Right.
Because sometimes stuff gets slips by too, and then 10 years later, it is way out of whack.
Are there any other rates we could peg this to? Like, for example, mileage, you have an IRS rate, right? Is there some other,
So I used a number of the closest thing I could get because I was asked by a number of people about the daily fee for travel purposes for meals. So I used AI and then Google, and the average is about $70 to $72 as a per day thing for somebody who travels. So that's why we rounded up to 75.
but I'm saying
In the business sense, I've used Runsheimer's
there's got to be some industry standards somewhere, right? There's a number of these,
Look that
human
up.
resources and management systems and employee mileage and employee reimbursement programs that there have to be.
Yeah, Runsheimer does that for a living. That'd be a
Runtime, okay.
Wisconsin company, but they do it for around the world. If you say you got to go stay in Budapest, they got a rate. They'll tell you what the rate is to stay there and what the per diem is.
Yeah, I'd like to just peg that per diem to something that way it automatically adjusts and we can reference exactly where the website is you go to get the rate. Because otherwise we find ourselves, 5 years from now, we'll be like, well, 75 isn't enough because we've had all this inflation and all of a sudden you're jumping it up to 90 or something like that. It'd be easier to just peg it to some national, international standard. Yeah. Yep. Alderman Bailey.
I agree with all the changes. Just two questions, and it's under the section of drug-free workforce and alcohol. Alcohol is defined as under the influence is defined as any detectable amount of alcohol, and drug use is defined as mentally or physically impaired as defined as any detectable amount of illegal drug. That feels very subjective to me. Is there like a blood alcohol limit? Like someone could have a bender the night before and show up with a detectable amount of alcohol in their breath. Does that feel reasonable? I don't know. That just doesn't necessarily feel like a measurable amount on paper.
I would agree on the subjectivity of that language.
I don't know. We can definitely look into that and bring that back to as a human resource topic. It's a very good question. I mean, under the influence is defined as any detectable amount of alcohol. And, if you're a police officer, public works driver, that is certainly going to be the case every time. There's sometimes where employees will go to a lunch or a dinner and there's drinks and then they'll come back. That's why we sort of modified this to provide that flexibility, or we have, an engagement at the park and then you come back and work for an hour and you have an alcoholic drink in you. We wanted to provide those flexibilities. We can look into that unless Nathan, you have any.
No, I mean, I do think though that any detectable level, that's a bright line rule, right? I mean, and it would be a PBT or, any of the other tests that we would administer in, say, so, I think it does create a bright line rule. And, if you want to say you can't be at it, you can't be in village hall, city hall working with any detectable level of alcohol in it, you can do it, you know?
Howard?
So following up on this section on page 11, and it says, whenever an employee supervisor has reasonable cause to believe that an employee is using and/or under the influence of alcohol or an illegal drug, the employee may be required to submit to a reasonable medical examination and may be referred to the city's EAP for further assessment. I guess medical examination, is that, are we saying some type of a test, like I mean, maybe we should spell that out a little bit more, clearly that you are agreeing to, say, for instance, take a blood test or an alcohol test or something along that line, so that it's an understanding that, you're agreeing that we send you up to the hospital for a test, you have to agree to that.
I think that also then would, if somebody has a medical issue and they're taking medication for a medical issue and it might make them look like they're impaired at work, it also then allows for that person to be cleared, right? That they weren't taking illegal substances, but there was something in their system that was prescribed by a physician for a medical condition. Yeah.
I guess I would just maybe make it more clear in that section that, you're agreeing to undergo some type of medical test to see if you're under the influence of drugs or alcohol.
Alderman Vukovic?
Two comments. In regards to what Philip said, I think we're missing the point of what he's saying. I know I don't drink that much, so this is not my fight, but as people, just like tonight, we have a brewer game. They may go out to have cocktails, and when they come in today, they may have been drunk the night before. They may have but coming in, they go out until midnight, 1 o'clock, but they still get here on time, but they still may have alcohol and registered alcohol, even though they feel fine or they're not impaired, but it's going to show. I see your point, because Packer games are Saturdays, or Sundays, and people come to work on Monday, and there is a residual, trust me, I know. That's the first thing. The second thing is, I know that there has been, and I would ask Nathan to look into this, but the requirement to take a breathalyzer or go do medical something or other when it comes to see if they're alcohol or not, or if they're drunk or not. I think there's something, a case that said that you can't do this. And the only reason I'm saying that is because I remember reading it in regards to you can say no to even a breathalyzer or doing things when you're on the road and you get arrested. Now, some consequences happen with it, but you can still say no. And it's almost like the same thing, like I think you can't put yourself into that category. So I just would look at that again, just to make sure. And that was recent, I read this. So I don't know if it was in the last 2 months, I think.
Yeah, I have a colleague who specializes in employment areas, and I can put something together. And I know she's got materials on this already, because I know she's assisted private employers with working up internal policies for employees.
Well, I'm just saying, if you've already looked at it, you don't need to. I just wanted to bring it up. If you think that we are, are sound on that ground, we can keep going.
Yeah, I don't know. I mean, I have to ask her to share her research, but I know she's done the work for other employers, so that should be pretty easy to come up with.
And I'm sure the collective bargaining agreement handles it a different way as well too, correct?
Oh yeah, absolutely.
Alderman Doherty, go ahead.
And is it just workplace alcohol and drug policy, drug free? I don't know. I guess saying you can't have the drink. I don't know. We got driving limits. I don't know that they're not zero. They're close, but they're not zero.
It's not uncommon, when you're talking about people utilizing heavy equipment, talking about police officers who are out on patrol, firefighters who are responding to, right, to say that you cannot show up if you are in any way in an altered state, right? You can't perform the job if you're in any way altered. And so I think that's part of the thing here. Most of the people who are in the employment of the city are either public works employees or police department employees. And so you only have a handful of people here in City Hall who aren't operating heavy equipment or, out on patrol or something of that nature. I mean, I think the case law would hold for a city to make that requirement, that most of the employed positions the city has are ones where you can't be altered and be able to do the job.
Or then just lay that out on the line.
Yeah.
Like say, police department, people who drive or do heavy vehicles, because they are used to that and they know that, and that is part of their job. They automatically know that. Abby may not know that. She might went and go out and have a couple tonight and come back to work and she's in trouble.
Yeah, if I may, I think
Right?
that this it seems like we're all ganging up on this. This is much better than it used to say just being employed. So, and really, I think the intent is there. If a supervisor has reasonable cause to believe that employees using under the influence alcohol is an illegal drug, they may be required to get a medical examination or EAP. Like that's just trying to help them out and say, I think this is the intent here is if there's a chronic problem, then that's when this will become a bigger issue. And
I never tried.
yeah, I know, but I'm just saying, you could very quickly say, you're caught, but I think it does cover the cases where you might need to have that termination. So, anyways, that's my 2 cents on it.
All right. Any other comments or questions on the employee handbook as presented? All right. Can we get a motion then to adopt the employee handbook as presented, knowing that we did direct staff to come back to us with a couple of clarification items?
One more comment.
Yeah, go ahead.
Don't forget to change on page 32 the at to an and sign. Just proving I paid attention and read it. 32K credit card use at small purchase policy. I think it should be and. Thank you.
That's a minor grammatical
Yes,
change,
yes.
but okay.
That's definitely policy related.
All right. So a motion, can I have a motion then to adopt the employee handbook?
So moved.
Moved by Schmelzing. Is there a second?
Second.
Second by Bailey. Any further discussion? Okay, all those in favor of approving, please say aye.
Aye.
Any opposed, no. Motion carries. And the final item is an ordinance repealing and replacing sections 2.3.2, city officers tenure, vacancy, and 2.3.3, city administrator. Mr. Warwick?
Thank you, Mayor. So the first thing to bring up is that Nathan and I have been working on this section for a while. Initially, there were some changes to 2.3.3 city manager. Those didn't make the final cut. We forgot to amend the title, so these are just changes and repeal and replace for section 2.3.2, which essentially repeats what it did before. Is it establishes the list of appointed positions in the city. And then for those appointed positions, they can only be removed by a 3/4 vote of the common council. If you want to, yeah.
Oh, sure. What it does do though, let me start with a 30,000 foot view. The idea is that certain appointed city officers should theoretically serve at the pleasure of this body, of the city council. So you could say, they're meeting their minimum standards or their requirements for their job. They show up on time. They do X, Y, and Z. But there's a philosophical difference, about how we operate municipal government that doesn't match with the direction that the city council wants to see us going in. So we're not going to continue to retain one of these appointed city officials, be it the treasurer, finance director, the clerk, the deputy city administrator, et cetera, that are listed. So what it does do, under the old ordinance, to remove one of those people, even though they serve at pleasure under state statute and can just be removed by the body, we used to have a full due process requirement. In other words, you had to give them the hearing that we all sat through a few months ago. It removes that level of review. There's no due process hearing. They serve at the pleasure. However, though, the trade-off there in compensation for that is you don't just necessarily serve at the whim, the majority of the council at any time. It has to have a 3/4 vote. So in other words, there's got to be everyone's got to agree that there's a serious, philosophical difference between the way that one of these appointed city officials is handling their duties. That's philosophically different than what the board wants to see, and that's perfectly fine to replace them. But again, so what it's doing is taking away that formal due process hearing and all of the rigmarole that went along with that. But it's saying, if we're going to remove one of these people, in fairness to them, and to have some reasonable expectation of continuing in their position as long as they're meeting the requirements, it's a 3/4 vote. So that's kind of the trade-off.
It's more like private sector, right? I mean, you end up being, it's at will. I mean, if you're in a higher office in a company, you're always at will. They don't like you, they don't like how you look, doesn't matter.
It was one other clarification. It says, it's titled Section 2.3.2, City Officer Tenure Vacancies. And then it says 2.3.3 is hereby repealed. And talking with Carl, that was as I understand it, that was inadvertent, right? And that there was no intention. 2.3.3 under the existing code just identifies what the duties and responsibilities are of the city administrator, and it was not the intent to repeal that section. Is that right?
Yeah, I wasn't trying to eliminate my position.
So the motion would be to approve the ordinance without repealing section 2.3.3.
Alderman.
The only concern I had is under section B1A, it takes an affirmative vote of 3/4 of the council. 3/4 of 6 is 4.5. It seems like should we just go with 2/3? It seems like that's a whole number, Yeah,
It's 4 of the 6 to hire.
Yeah,
And 5 of the 6 to remove.
That's a policy.
Right.
And it just seems like an odd thing. It seems like 2/3 to me, would make more sense. Just throw that out there.
Right. And in both of these situations, if you look at the way the ordinances are written, the mayor makes a recommendation. So I don't have a vote in it. So it has to be 4 of the 6 of you to appoint somebody. And then, like, for example, when we had the situation of removing the clerk, I was making a recommendation. I was the charging agent, right? And it took 5 of the 6 of you to remove the clerk. So the mayor doesn't have a vote in this. And so you guys need to decide what percentages you want of the 6 of you. So I hear you saying, that seems like there's a discrepancy here. I mean, do you want to propose something different? Do you want to direct staff to bring this back with a different recommendation? I mean, how
I would suggest 2/3 just because it makes more sense to me that, it's a whole number.
Okay. Alderman Vukovic? Mike, you just need to speak in the mic.
I'm sorry. I don't understand why it would be harder to get someone fired than to hire. I mean, if it's even, it's even. Like, you should be doing the same due diligence when you hire somebody as fire somebody. So I don't care if it's 3/3 or 2/3. It just has to be consistent. I don't think it should be harder to get somebody out, because the only reason you're trying to get somebody out is because they've done something. And if they've done something, it's harder to get out than when they get hired. I'm gonna agree that I think it should be 2/3.
So right now, Alderman Gelhard, I'll give you back the floor. Would you like to propose that we adopt this, but any references are all 2/3?
Yeah, I would move to amend section.
Well, we don't need to make an amendment. We don't have
Okay.
a motion yet. You can move to adopt the ordinance, but changing any references to 3/4 to 2/3. So that,
Could I make a procedural suggestion, just so you don't go down the rabbit hole and have to vote twice on the sub-agreement?
no, that's what I was stopping you from doing. He was
Yeah,
trying to make
yeah.
an amendment, and we don't have a motion yet, so.
Why don't you just kind of take a straw poll and see just see where everybody stands? Because if you make a motion to pass with the amendment, then, well, I suppose you could just.
It's not an
Yeah,
amendment.
I mean,
We don't have a
not an
motion
amendment.
yet.
It's you could theoretically just make a motion to pass, but with 2/3 rather than 3/4. You could do that. And you wouldn't need the amendment, but you could just take kind of a straw poll first and see where everybody stands, and that might
Could I
help
make
you
a
a little
comment
quicker.
real quick, just from a staff perspective before we do that straw poll? That the reason we left it as 3/4 is how it was, and eliminating the section regarding the due process eliminated a huge cost and burden to the city for terminating employees under certain circumstances. Some of these appointed positions can be a little political, and so we still wanted to give the council the ability to do it at an easier process, but still maintain a somewhat difficult aspect of trying to get rid of an employee because two council members may not like a person. We wanted to make it just a little more difficult to protect the employees that we do hire, because a lot of employees that we do look to hire, they do look at these termination clauses to make sure how secure their jobs are. So to recruit the most qualified people, we wanted to make sure we maintained a protection with the council.
And I forgot, that's an excellent point. It was, correct me if I'm wrong, because I reviewed it this afternoon, it was 3/4.
It was 3/4 prior as well.
Right now, we do not have a motion on the floor. We have a recommended ordinance language that has been presented to us by the city administrator and the city attorney. So we can have a motion to adopt the ordinance as it is, a motion to adopt the ordinance changing any references to 3/5 or to 3/4 to 2/3. Or you can make some other motion if you like, or you can ask staff to, you can lay it over to the next meeting and ask staff to come back with a different recommendation. So any number of things.
Well, I would make the motion to pass this, changing the reference to 3/4 to 2/3 in section B1A.
All right, is there a second to the motion?
I'll second that.
Okay, so moved by Gelhardt and seconded by Doherty to adopt the ordinance language as presented, but with the exception of under B1A, the reference to 3/4 would be changed to 2/3.
Oh, and also not including the deletion of 2.3.3 city administrator.
Yes.
Yeah, okay.
Not including the.
Otherwise, Carl,
Is that
Yeah.
yes?
Acceptable. Yeah.
Okay.
otherwise Carl won't have a job visit tomorrow.
Okay, so ordinance language that was presented to us, we are not deleting 2.3.3, and we are adopting the language as presented, except B1A would say 2/3 instead of 3/4. It has been moved and seconded. Is there any further discussion?
Quick.
Yeah, Alderman Schmelzing.
Yeah, I think 2/3 is still a pretty high bar. I think it's more than we have in most business environments. And I think that we also want to be cognizant that people have to keep up their game, right? So I do think that probably 2/3 is fine. And also just logistically, you still need to have, every member here, and you have to have 2/3 pass it. So, and that doesn't include the mayor in these situations either. It's through the council. So it's like, you can't just have, one individual kind of sway things. So I think it's fair. And yeah, I think it'll help take care of some of the other concerns we ran into most recently. So, yeah, I'm good with it.
All right, any further discussion? Okay, all those in favor of approving the motion, which is to adopt the ordinance language as it was presented, except that we're not deleting 2.3.3 and we're changing 3/4 to 2/3 in B1A. All those in favor, aye?
Aye.
Any opposed, no?
Oh,
Okay, by a vote of 5-1, motion carries. And, you know, I would just say, now that we've approved this, I did not weigh in, but I would say I do agree with that. If a majority of the council is unhappy with somebody's work, it just, I mean, to me, it just makes sense, right? That it takes 4 of the 6 members of the council to hire somebody. It would take 4 of the 6 members of the council, with the mayor not voting in either situation, to eliminate, or to terminate somebody. So,
Well, it's not just unhappy. It would be you're unhappy and we can't seem to settle it, right?
Right.
I mean, you could have a time where you disagree with somebody or anything else. That doesn't mean we're firing somebody. It
Right.
doesn't mean if we can't get past that, it's an issue.
right,
So-
exactly.
And the other thing is, I hate that one person could derail everything that the whole other council, like, one person would be okay, but they, like, it's too many, it's too much. 5 people, one person can do it just because of principle. And I think it goes back to the political aspect of what you were saying, that they might just be, so I think it's a little more leeway, but we still, hopefully, if, as people are on the council and they do the right thing, they figure it out.
Happened.
Happened once.
That's what I'm saying.
Yes, all right. We'll go to the commission, committee, board, and staff reports. The ICC met today. The next ICC meeting is actually going to be hosted by Glendale, and that will be on Monday, November 10th. So it will be here in the council chambers at City Hall. So if any of you wanting, I'm giving you an advance notice of a month in case any of you want to attend, you're certainly welcome to attend. We'll be hosting the next ICC meeting on Monday, November 10th. 12:30, lunch is served, 1 o'clock is the ICC meeting. I don't really have anything to report from the ICC meeting today, other than Alderwoman Vukovic, in her day job capacity, came and did a presentation about the work that they're doing, helping with voter registration. So she had several people from her organization there. It was a really good, thoughtful discussion, a good presentation. So the North Shore Fire Department is not meeting tomorrow morning. I was noticing I don't have an agenda for it. We met just 2 weeks ago, right? We met late in September in order to approve all the stuff that we just had before us, and so not meeting tomorrow morning. There is a ribbon cutting tomorrow for DentaQuest at Bayshore, and there is the Arden, which is under construction on Good Hope, on Wednesday at 2 o'clock. There is, so they did not do a groundbreaking, but they're doing a capping, I think it is. So whatever that means, I just know I'm supposed to show up at 2 o'clock and I'm supposed to speak for like 60 seconds. So whatever, I don't know. They're doing something. So
The
yeah,
environmental area was capped. That's why they're doing the capping.
yeah. So that is on Wednesday at 2 o'clock. And yeah. Yeah, and then afterwards, there's an event at the Bavarian. There's like a reception or something. So those 2 items coming up tomorrow and Wednesday, and that's all I have to report at the moment. So I will now turn to the city administrator. Anything to report?
Yeah, the budget is scheduled to be ready by the end of the week. We will have it ready and at least sent out electronically. We will have to wait and see how long the printing will take, but it will definitely be distributed electronically by the end of the week.
Okay. And I believe you also did interviews for clerk position?
We did 5 interviews for the clerk position, and we'll be making a recommendation shortly on that one.
Okay, thank you. City attorney?
Thank you.
All right, deputy clerk?
Next week, Saturday, we have our Spooktacular and Fall Festival at Richard E. Maslowski Community Park, and that's from 5 p.m. to 8 p.m.
Chief?
Nothing to report.
Okay, number 1?
Is 100% correct. This is we're gonna do some spooky kind of fun stuff with the hay sort of ride. There's gonna be some trick or treating. We're asking all alders to participate in this one. This is one of those ones where this is maybe our last one for our 75th kind of anniversary. Asking everyone to participate and be a part of it, because this might be the last one before December.
What day and time again?
Saturday from 5 to 8.
Okay, at Maslowski Park.
Yes.
Okay.
Saturday, the 25th.
Oh, 25th, okay. All right, anything else for number one?
Nothing tonight.
3. 4,
Nothing this evening.
5,
Nothing.
6.
No report.
Actually, I do have 2 other quick things. I was asked to submit a letter congratulating Valerie Kaminsky, who lives at 2340 West Kemborn Drive, on her 100th birthday. So I have that letter here that I will send off. And also, I did talk with Amanda Seligman, and her committee did receive proofs of our book. So we will have a book out probably Thanksgiving-ish, beginning of December. So we'll be planning one more event when that book will be unveiled, and we'll have that probably here at City Hall. But just wanted to give everybody the notice that the book is out there. So, all right. What? Books or authors site. All right. That concludes all of our business. Can I have a motion to adjourn, please?
So moved. Second.
Okay, moved by Gelhardt, seconded by Doherty to adjourn. All those in favor of adjourning, please say aye.
Aye.
Any opposed? We stand adjourned.